Good morning, all. I'm here to present a case report on a large wooden intraorbital foreign body. There is no financial support or sponsorship. Coming to introduction, intraorbital foreign bodies are a global phenomenon and occur with a frequency of 1 in 6 orbital injuries. However, intraorbital wooden foreign bodies are uncommon. Intraorbital wooden foreign bodies predominantly affect a male population with a mean age ranging from 18 to 25 years. These vegetative foreign bodies must be removed as it serves as a needles for orbital infection. We report such a case of a large intact intraorbital wooden foreign body which was removed successfully and improvement seen in the ocular status of the patient. Case history: a 25-year Hindu male from Odisha presented to the casualty with a sustained wood penetrating injury in the right eye. He had a history of an accidental fall from the tree on the same day. On examination, patient GCS was 15 out of 15. On ocular examination, we found on right eye visual acuity was perception of light, and on left eye it was 6/9. There was restriction of extraocular muscles in all direction in right eye. On anterior segment examination, there is mild proptosis along with congestion and chemosis. There was sealed corneal tear present with corneal edema. The pupil was dilated and not reacting to light. AC was maintained, and a large wooden foreign body located at the medial canthus. Here it is a picture. It is a picture the patient at the time of presentation. The fundus examination was not possible due to very hazy media, and the CT scan of the orbit was done, and the air density was found in between the middle wall of the orbit and globe. There was no intracranial or nasal cavity penetration, and the globe was intact too. Coming to the management, the patient was hospitalized and injection tetanus toxoid along with intravenous antibiotic and analgesics along with moxifloxacin eye drops were administered. After neurology consultation, the case was planned for exploration. The peribulbar block was given, and under all aseptic condition, with the help of artery forceps, the wooden piece was removed intact. The size of the foreign body was 8 into 3 centimeter. The wooden area was clean, and the gap was closed by retracting the globe medially with 6-0 Weichel suture. Then intravenous ceftriaxone along with diclofenac and pantoprazole and oral fluconazole was given, and antibiotic with steroid and eye ointment combination were given post-operatively. Here it is a picture of pre-op and intra-op, and the size of foreign body is 8 into 3 centimeter, and post-operative images of the patient. On day 1, the wound area was healthy and no discharge found. Chemosis and corneal edema subsided. The pupil was dilated and not reacting to light. The vision was still perception of light. On day 3, the mild congestion was present, but chemosis was resolved. And on day 4, the patient was discharged with oral antibiotic, oral steroid, and topical eye drop and eye ointment. Discussion: the retained wooden foreign body may lead to complications such as prolonged suppuration, orbital cellulitis, abscess formation, panophthalmitis, extraocular muscle damage, and even brain abscess. As there is no definite imaging studies, CT scan is usually performed in orbital trauma cases where foreign body penetration is suspected. After excluding the possibility of the metal foreign body, MRI can be performed in an open injury with wooden foreign body. The surgical removal of the wooden foreign body requires extreme caution. Utmost care must be taken to prevent fragmentation of wooden pieces during the extractions. At last, I conclude that 90% of the orbital injury is preventable, so prevention is better than cure, and implementing the appropriate imaging modalities and diagnosis, imaging modality for diagnosis and careful surgical removal of foreign body is critical to minimize complication and a good post-op outcome. These are my references. Thank you.
Thank you, Dr. Sasmita. Just wondering why so many orbital foreign bodies, and that too wooden. Is there any specific reason, and can you prevent these?
So, as prevention, patients need to be more careful.
No, what is the setting under which they get this?
Mostly they are from rural and working in fields or.
I think farming, bamboo farming, and those handicraft with bamboo sticks are there. So that may be the cause of it, because when you cut the bamboo,
yes,
they may just fall in the speedily. The sharp wound can
yes,
be done with those things.
yes.
And the other thing which is surprising is that these wooden sticks they don't enter the eye. Why? They are just in the orbit. None of these have hit got into the sclera.
In my,
Do you have any explanation for that?
no, sir.
No?
In my case, there was no intracranial or
But
nasal
there
cavity
can be,
content.
no?
There can be, but in my case, there was none.
I think they may have closed their
So you
reflections
said
of-
PL initially, no?
Yes, sir. Perception of size.
Yeah, but then the person retained 6/9.
No, sir.
Huh.
Not in this case.
Not
in
It was
this
the
case.
last,
Okay,
last.
okay, okay. So probably because I think these foreign bodies are not sharp edged. So that might be the reason that they are not able to penetrate. And then the velocity with which they are hitting the eye may not be that sharp as running iron foreign body or something would be. So those are the things which come to my mind, if that can be the case. Otherwise, it's a good presentation. Thank you. But just wanted to know what else can you do to prevent this? Because these are hazardous, of course.
I think only protective glass is the option which we can
Protective
give.
glass.
No, but I don't know if you can give protective glasses to whole of your population, you know, and that too rural. How can we advocate that, you know? Only thing, correction of glass, refractive error might be important.
If
Yes.
someone is having that,
Yeah, because if you are not able to see the distant objects, you might be at a more risk of getting injuries.
So, but it is a case of accidental falls.
no,
From
because
the
I was
tree.
telling you we can do reflection.
We can
This
do,
is,
yeah,
Yes, sir.
yeah.
screening for the
One
refractive.
preventive aspect can be that if the person is not seeing clearly, he may be at a more risk of injuries.
Because in this, the left eye was 6/9, so in that eye also may need correction.
Never know.
Yes, sir.
Thanks a lot.
Thank you, sir.
It was a nice presentation.